and great to have back with us U.S. Congressman from Ohio's 2nd Congressional District, Brad Wenstrup. Brad, good morning. How are you, sir?
I'm doing fine. Good to be with you.
Glad to have you along. And I don't know if you've ever been to Martha's Vineyard, but it might be nice if the Obamas would open up their home for some of those migrants that they say that they care about.
Yeah, isn't that interesting? No, I haven't been to Martha's Vineyard. It's not necessarily on my bucket list these days. I'm pretty comfortable in Southern Ohio, to be honest with you. But it was very interesting what took place. I got to give Ron DeSantis, governor of Florida, a lot of credit. And actually, they want to call this inhumane. Well, they got treated better than they've been treated in probably months as they made their way into the United States of America. Look, I don't blame people for wanting to come to the United States of America. The process has just been ridiculous. Cartels are the ones that are winning. But aside from that, on this particular issue, you have 48 people that went to Martha's Vineyard, and this is a crisis for them up there. Meanwhile, other states and other places around the country have taken on thousands and thousands of migrants. But up there at Martha's Vineyard, 48 people show up after they've been given a night in a hotel, fed, showered, haircuts, whatever they may need. They get a brochure of all the assets that Massachusetts offers. You've got sanctuary cities in Massachusetts, and people are sent there, and this is somehow inhumane, when it's probably the most humanely they've been treated in some time until they got to Martha's Vineyard. And then Martha's Vineyard brings out the National Guard to take them away. We've had, in just the last 24-hour period or so, that they had 48 people go there, but we have thousands coming across the border every single day. And, it's just been crazy what's happened around the country when some of the migrants show up in some of the areas where they're all for this. They're all for this illegal migration. Yet you send them to Illinois, they call out the National Guard. Mayor Bowser here in D.C. calls it a public health emergency. I'm not sure where she gets that. That seems like kind of a stretch. In New York City, the mayor says that New York City has reached their breaking point, and yet at the same time, Kamala Harris says the border's secure. So you scratching your head on that, Tom?
Yeah, that doesn't make any sense. And we're not allowed to use the National Guard at the border. It might make sense. I mean, if we don't have enough border patrol, but maybe we could use some IRS agents. I understand there's going to be a lot more of them.
Yeah, you got 87,000 IRS agents that Democrats have supported, and you go down to the border, and the Border Patrol agents say, "Could you please get us more Border Patrol agents, because it's we're just so underserved." But no, we're going to do IRS agents. Tom, I was thinking about this arrangement of Democrats and 87,000 IRS agents. And I was kind of thinking about that in church a couple of weeks ago, because they were talking about tax collectors and sinners. And I couldn't help but draw an analogy there, but I guess that's what we're dealing with these days.
Yeah, absolutely. Congressman, talk about the things that are really, really affecting people in Southern Ohio right now, and inflation being the biggest one.
Well, there's no doubt about it. Inflation is definitely the number one issue that's on people's minds. And it's become very costly, as we know. It's a tax on all Americans. It definitely is. And really, it's affecting the middle class more than anyone else. You're seeing the cost of food and energy go up, but it's also hitting renters. And that's the middle class of America. That's the heart and soul of a lot of people that live in our region. It's they're middle class people. They're renting, and the rental costs are going up and up and up. Fox did a poll. Inflation was the number one issue, and it's been said that on average, an American household is spending more than $700 a month more than they were just a year ago, and that's about $8,000 a year. So food prices are up around 11%. We can go down the list. You go through eggs, airlines, gas, food, all the staples that we rely on, electricity, all of those things have gone up dramatically. And, we're we've seen this administration just continue to do things that drive up the inflation, and then they pass the Inflation Reduction Act, which is misnamed. They have a celebration about it, and at the same time, what do we see? The same day that they're celebrating, Tom, we see that in August, the Consumer Price Index came in hotter and higher than expected at 8.3% for the last 12 months. So there's no inflation reduction, unfortunately. I think the best thing that we can hope for is a change in things in Washington come November after the election, but we still have the lame duck period to get through, and they may try to do more damage in that time, but we're going to do everything we can to slow this process down. Maybe some people are starting to get it. Maybe some Democrats who are in tough races may understand that it's time to back away from their spending because this is driving the inflation.
And the student loan, my goodness, paying off those student loans, that's just going to add even more to inflation if that goes through.
Yeah, it is, and that's it's just so insulting. You know, why are the American people responsible for somebody else's loan? When has that ever happened? You know, I did an interview when the announcement first came out, and it was an interview right outside of my home. And I said, why don't you go down the street to the cafe down there, go into the kitchen and talk to the people waiting tables and the people bartending. Ask them if they're happy with the notion that there's going to be money taken out of their check to pay off somebody's student loan. You know, the unfairness of this is unbelievable. But this kind of goes to how the president likes to use the pandemic, which I feel has been over for probably over a year in many ways. You know, we do have people getting various forms of COVID, but as far as it being a pandemic and to use it as a public health emergency, now he went on 60 Minutes and says it's over, but he's using that at the same time to say that that's why we need to give student loan forgiveness. So the hypocrisy just keeps on piling up, and this is just another example of it. And we still have people in the military that are being let go because they haven't been vaccinated, and they may have more immunity than somebody who's been vaccinated if they got COVID, and we're not dealing with that. So the hypocrisy just keeps on coming.
Yeah, I think that's the thing. If the pandemic is over, and that's one thing I've agreed with Joe Biden on. I believe it is over. I think we're doomed to just have COVID with us, maybe forever, kind of like the flu and other viruses. But you have the military still under a mandate, federal employees under a mandate. You have the FDA giving approval, at least emergency use approval of these new vaccines that are coming out. And that's concerning because the trials really have not proven anything. And are you, as a doctor, are you concerned about some of these things?
Well, yeah, I am. You know, I will tell you, I think that the initial vaccine saves hundreds of thousands of lives. The original form of COVID was very deadly to a lot of people, but mostly to a certain group of people with comorbidities, people that had some immune disorder. And the benefit was worth the risk, and I think a lot of gains were made. But look, even in the trials, we knew that people that got vaccinated still got COVID. There was a certain percentage, and we also know that viruses produce variants, and we need to be honest with the American people that that's what's going on. I got vaccinated, but I also got COVID later. And what's ridiculous is I was being told, not by a physician, but I was being told that I had to get a booster if I wanted to travel to a security conference in Germany. Well, I said, let's check my antibodies first. Well, a strong number of antibodies was 40. My number was 821. What's really missing here, Tom, is we don't have individual medicine anymore, and we've taken doctors out of the equation. You have a politician telling people they have to get this shot in their arm without a discussion with a physician on the risks, the benefits, just like we do for any other medication that we prescribe. And he's telling you got to get this or you're going to be fired from your job. Now, this is unheard of. This is really dangerous for medicine itself and for patient care. People deserve the opportunity to sit down with a physician, talk about the pluses and minuses of a vaccine, the risk they have for their age group and for their health status. Isn't that what we have normally done in medicine when it comes to taking any medicine or with any diagnosis or with any health threat?
Yeah. Yeah, and I think in the past, it was from the bottom up that we learned how to deal with it, not from the top down. And there's a lot of doctors on the front line that have been dealing with COVID in various ways and having successes. And I think it's important to take a look at that, whether it's use of off-label, ivermectin or whatever, and the use of intravenous vitamin D or vitamin C, just different things like that doctors have had success with. I think that's important to look at, but it seems to be silenced, especially on social media.
Yeah, and we went through a tremendously interesting time in medicine where you had people coming down on doctors when they use things off-label. We've always used things off-label, especially when you don't have anything else to treat a patient. And it was inexpensive treatment, and it does no harm. It's FDA approved, and they were making a bigger deal of it than it certainly was, and going after doctors. I had doctors calling me saying, I'm being called by this board and that board and being challenged because I'm prescribing these medications which have done no harm. And patients understood that there was an outside chance that it might not help them, but we mostly saw positive results and certainly no negative results. And this is just a weird time. Medicine has become politicized. Our healthcare system has become politicized. And we got to get back to doctor-patient relationship, which, by the way, is one of the main tenets that we're going to be pushing out when we release our Commitment to America that we're going to release this Friday.
We'll talk a little bit about that because it's so important that if the GOP takes over in the House and the Senate, that the American people know what the plan is.
Yeah, one of the things that we've been doing in the House of Representatives, besides coming here and voting no and getting defeated time and time again by the Democrat majority, is preparing to take over the House. And we're working hard to do that on all fronts. But one of the things we're doing is putting together our policies. And we've reached out to stakeholders. We've reached out and we've had our own Zoom calls and our own briefings from people that are in the arena of energy, healthcare, whatever the situation may be, and talk about how things are affecting them and what kind of policies are hurting them and what kind of policies will help them. And I'll just start with healthcare, for example. We're going to be concerned about having Americans have the opportunity to be healthy. A lot of times Democrats like to just talk about you have insurance or this and that. Well, that doesn't mean you can afford your care because your policy may have a $10,000 deductible. We're going towards providing innovative treatments, making them accessible, lowering drug costs without stymieing innovation for the future. And all of these things are in our Commitment to America for the American people to see. And we're doing the same thing in energy and on defense. And so we'll have a lot for people to understand what we're running on and what we plan to move forward with. And to the point where we're even starting to craft some of the laws that we'll take through committee and try to get on the floor as soon as possible.
I believe that the investigation into Trump, the whole thing with Mar-a-Lago and the raid, that's all setting up to for Biden and the Democrats to have some type of an advantage here in November. But the question is, was there anything done wrong here by President Trump?
That is the question, and I think America's starting to raise their eyebrows. Even some people on the left are starting to say, what is really going on? Look, you had 2 years of Russian collusion, and it was clear that nothing was done wrong. But we saw the FBI and the DOJ being involved with the Russian collusion hoax, with promoting the narrative, with abusing the FISA court to spy on American citizens. And, I'll even go to what the FBI did with the shooting at the baseball field, where the guy clearly was there to try and assassinate Republicans, and they called it suicide by cop. and they still won't let us on the Intelligence Committee take a look at the case file to how they got that so wrong. So the American people are starting to see and things that just don't add up when it comes to our agencies. And Mar-a-Lago, because of the previous things in particular, people are raising their eyebrows. And we on the Intelligence Committee should be informed if there's some national security risk. Our agencies have gotten away from the notion that they are responsible to the American people and to the representatives of the people, and especially to the Intelligence Committee. We've gotten no brief. We have gotten no brief about what they were trying to look for at Mar-a-Lago. And I do think it's odd because, you know, when I'm in that secure facility and I walk out, our staff makes sure we don't take anything out. I just don't see Donald Trump boxing up classified information and putting it in his car and driving it to Mar-a-Lago. We should have a system in place. We have these agencies like the archives. Are not they having oversight over what's going out of a secure facility? Because they should be. And if they're not, then that's something that we got to change. And rather than go back later. And, you know, we're hearing from the president's people that a lot of these things were declassified, which he has the right to do. But I will tell you what bothers me as much as anything else sitting on the Intelligence Committee is we haven't heard anything. We've got no information. They're responsible to reply to us. We're hearing, all we hear is from the leaks, the same that you do. It's just leaks that come out, and that's where we're getting our information. Yeah. We've got to turn this ship around. This is a government of the people, and the agencies are responsible to the people and the representatives that are here for the people.
We're talking with Congressman Brad Wenstrup from Ohio's 2nd District. He's a colonel, U.S. Army Reserve, and a doctor who, by the way, you mentioned the shooting at the baseball practice 5 years ago. Dr. Wenstrup, Congressman Wenstrup, attended to Congressman Scalise when he was shot. And so you really helped Steve Scalise before he was transported to the hospital, right?
I had the opportunities by God's good graces to put me in a good position to be able to help Steve. And there's no doubt about it, in that environment where 136 rounds were fired, my year in Iraq was very beneficial as far as staying calm, handling the situation as best we could. I credit my Army training kicking in because it really did that day. And you know, Steve reminded me of a lot of situations that I had seen in Iraq, and fortunately knew what to do, what I could do, and I also knew that more needed to be done from the time he left the ball field, and a lot was done. So the system worked.
Yeah. You know, you talk about the FBI and what happened with Trump, and you know, the fact that you're not getting, still to this day, 5 years, the information you'd like to have from that shooting. Do the American people still have confidence in the Federal Bureau of Investigations?
They really don't. And, you know, it's interesting because I will tell you that I think people do have confidence, and I have confidence, for example, in my local FBI agents, the ones that are out there pounding the pavement and doing the work each and every day and trying to keep America safe. The problem has been very specific to the upper levels of the FBI, especially here in the D.C. region. We're not seeing problems like this necessarily across the country. It all seems to be focused at the upper level. You know, we often talk about term limits for members of Congress and Senate and all these things. What I would come convinced of, Tom, since I've been in Congress, is we need to put term limits on people in the agencies because they're there for decades. They're there for decades with a lot of authorities, and I think that we've seen a lot of people develop what I call arrogant authority, and they decide that they can decide what's best for America or who should win elections and things like that, and they play a role in that regard. And we've got to have more transparency, and that's what we'll be working for. And the case is being made, and we're going to continue to push it. This responsibility is there. And as I pointed out at one point during the hearing in the Intelligence Committee, I said, look, you got to understand, we created your agency and we fund your agency. And even one of the Democrats said, if you're not going to be open with us and tell us what you're doing, it's very hard for us to want to encourage members of Congress to pass the budget that you're asking for. And so maybe we have to do a little bit more fencing of funds and say, until you give us what we want, you're not going to get paid.
Yeah. Congressman, the announcement about Visa, MasterCard, and American Express working with the government here to categorize gun store sales of guns and ammo, that's very concerning. Harkens back to the days of Obama's Operation Choke Point.
Mm-hmm. Well, I would take that and just see what's happening in many venues, especially with high tech and the media. What the government can't do by Constitution, they try to get private business to do. So if the government can't halt your free speech, they'll go to high tech and media, and they'll start governing your free speech. So you're reaching out, and just what you're seeing too with this environmental and social governance, and you have independent agencies, banking, et cetera, saying, oh, if you don't support these social issues, then we're not going to work with you. It's a form of extortion that we're seeing out there because government can't legally do these things, so they're trying to get private entities to do it. And we've got to put an end to that as well.
Yeah, absolutely. All right, U.S. Congressman Brad Wenstrup from Ohio District 3. Sir, thank you so much. Great talking to you.